This is Health Broadcasting Service HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
HBS Radio is who you're looking for.
Weekly news update, coming to you from the Health Broadcasting Service HBS radio channel. Time to start inching back toward normality, says Fauci. Top United States infectious disease expert Dr. Anthony Fauci said on Wednesday that it is time for the United States to start inching back towards normality, despite remaining risks from COVID-19. In an interview with Reuters, Fauci said United States are facing tough choices in their efforts to balance the need to protect their citizens from infections and the growing fatigue with a pandemic that has dragged into its third year. There is no perfect solution to this, said Fauci, President Joe Biden's top medical advisor and a member of the White House COVID-19 response team. Earlier on Wednesday, United States health officials said they were preparing new COVID-19 guidance on many aspects of the virus response, as the Omicron surge in cases declines. That followed announcements by several states including New Jersey, New York, California, Connecticut, Delaware, and Oregon that they were lifting mask mandates for schools or other public settings in the coming weeks. The fact that the world and the United States, and particularly certain parts of the United States, are just up to here with COVID. They just really need to somehow get their life back, he said. You don't want to be reckless and throw everything aside, but you've got to start inching towards that. Even with the positive trends, COVID numbers remain high with some 2,200 Americans dying each day, most of them unvaccinated. The current 7-day daily average of COVID-19 cases is about 147,000, a decrease of some 40% from the previous week, according to government data. Over the same period, hospital admissions fell about 28% to 9,500 per day. Fauci acknowledged that states' revised policies could involve trade-offs and some unnecessary infections, but hewing too closely to strict prevention policies was also harmful. Is the impact on mental health? Is the impact on development of kids? Is the impact on schools? Is that balanced against trying to be totally pristine and protecting against infection? I don't have the right answer to that, he said. In another report, World Health Organization must be bolstered to strengthen global health security, says Tedros. Any initiatives to strengthen global health security in a future global health crisis will only succeed if such measures bolster the role of the World Health Organization, WHO. Director General Tedros Adhanom Ghebreyesus said on Thursday. Speaking via a video link at a G20 meeting of finance leaders in the Indonesian capital, Tedros was responding to proposals to establish a separate global health fund, tasked with delivering emergency funds, vaccines, and other medical needs. And finally in today's segment, Moderna eyes COVID booster by August, not clear yet if Omicron-specific needed. An Omicron-specific booster could be ready by August, the chief executive officer of United States biotech firm Moderna told Reuters, but the firm is still gathering clinical data to determine whether that vaccine would offer better protection than a new dose of the existing jab. Last month Moderna began clinical trials for a booster dose specifically designed to target Omicron, but initial results from studies in monkeys show the Omicron-specific shot may not offer stronger protection than a new dose of the existing vaccine. Moderna chief executive Stefan Bancel said in an interview the company aimed to have a booster ready by August 2022, before next autumn, when he said more vulnerable people may need it. Moderna's vaccines use mRNA technology to provoke an immune response, similar to the shot developed by Pfizer-BioNTech. We believe a booster will be needed. I don't know yet if it is going to be the existing vaccine, Omicron only, or bivalent. Omicron and existing vaccine, 2 mRNA in one dose. He said a decision would be made in the coming months when clinical data becomes available. Bansal also confirmed that under the best-case scenario, Moderna would have ready by August 2023, a so-called pan-vaccine, which would protect simultaneously against COVID-19 flu and other respiratory diseases. He added that pricing for this vaccine under development would be very similar to that applied to the current high-dose flu vaccine, boosting sales in Europe. Separately, Moderna announced plans to expand its commercial network in Europe in a bid to increase sales on the continent. Moderna plans to establish a commercial presence in Belgium, Denmark, Norway, the Netherlands, Poland and Sweden to support the delivery of mRNA vaccines and therapeutics locally, the company said in a statement. These new European subsidiaries will be added to commercial offices in Italy, France, Germany, Spain, Switzerland, and Britain. Moderna is also boosting its commercial presence in Asia. In Europe, Moderna produces its vaccines through manufacturing partnerships, which include Lonza in Switzerland and the Netherlands, Rovi in Spain, and Recipharm in France. The company shipped last year more than 800 million COVID-19 shots globally, and has deals with European Union countries for the supply of up to 460 million doses. Besides vaccines, Moderna is also developing mRNA drugs against a range of conditions including cancer, cardiovascular, and rare genetic diseases. And that is all we have for you currently on this segment. We will be back with more updates as news develop. Engage with us on our social media Facebook and Instagram platforms at Health Broadcast. You can also visit our website at www.healthbroadcastingservice.com. Remember to press the subscribe button to stay abreast of vital, interesting, and authentic health news from across the globe, brought to you by the Health Broadcasting Service HBS radio YouTube channel. Please stay safe and remain healthy.
You've been watching the Health Broadcasting Service YouTube channel, your channel of excellence and distinction. Pioneering specialist radio broadcasting, giving you the best experience. Subscribe to our channel